Good afternoon, class. I did my case study 75 for week 4. Mine was about MC, a 29-year-old male who presented with being out of breath, run down, and a slight fever when he came into the clinic. The case 75 is called, talked about as acquired immunodeficiency syndrome. It's about people with HIV and how some can be carriers and some can be, goes into the full-blown AIDS. Well, two of the most significant risk factors for developing HIV is unprotected sex and homosexual activity. Our patient, MC, was put on or has been taking a dapazone, which is an antibiotic to help treat any infections that he may have to fight off bacterial infections. He presented with the clinical examination to support his diagnosis of being diagnosed with pneumonia because he was actually ill appearing and he had bibasilar crackles upon auscultation when his lungs were examined. For his past 2 visits to the HIV clinic, they do a test called the HIV marker, and this indicates, what level they're at. Well, his has decreased dramatically the last 2 visits he's had, which is a good thing. However, he's not out of the clear. When they did the lab values, his arterial blood gases came back within normal range, and the normal range for the O2 PaO2 is 60-65, and his was 63, and the PaCO2 35 to 45. So he was within the normal ranges of that. AIDS defining the manifestation or complications of the patient with HIV to develop, you'd have to test positive for the ELISA and the Western blot test, which our patient did. His lab results came back that he is leading possibly to kidney failure, and he is currently in the symptomatic stage, not quite to the fatal stage yet, but getting very close. Questions from the audience. Can I define what lymphoepathy is? It's an abnormally large lymph nodes, commonly called the swollen glands, which are located in your neck, the armpits, multiple places throughout your body. And you can tell when you're getting like the flu or an infection, they get swollen and your throat gets swollen and stuff. That's how you can tell. Not saying everybody's got AIDS or HIV, but it's showing that there's an infection. How can AIDS be spread rapidly in the third world countries? Well, there's no good medical care available. The conditions are horrendous. There's no clean or sterile areas. And another one is the multiple unprotected sex partners. Why do we have the inability for science to develop an effective vaccination for HIV? Well, where do we begin? An HIV-infected person, infections even when they have no symptoms are present. And as a result, the infected person will sleep with this person or give blood to this person and transmit the virus to others before their own infections can be detected by HIV testing. That's a scary thing in this day and age, especially if you have young children like I have, a 6-year-old daughter, and now we're really going to be kind of watching around the corners to make sure in the future, are they going to have to have everybody tested before they even get married or consider dating or something? It's a scary thought. And it continues, the AIDS virus continues to mutate and spread globally, causing non-discriminate pandemic. It affects people worldwide without regard for their age, their race, their gender, or social class. The most common cause of HIV infection AIDS in American men today, male-to-male sexual contact, in high risk, oh, excuse me, let me back up there. The most common cause of HIV infections and AIDS in American men today are the answer for both male-to-male sexual contact. And in women today, the high risk of heterosexual contact. Too risky. Protected sex, protected sex, protected sex. That's the way to go. Can you catch the virus by sharing toothbrushes and shaving razors? The only way you can catch it is if your saliva and their saliva come in contact, or your blood and their blood. So yes, if you have an open sore, you can get it. If you cut yourself shaving by using their razor, and if they've cut themselves, yes, you can. Usually the AIDS virus itself doesn't live with, once it hits the air, it dies, but HIV, yeah. Researchers once believed women who used spermicide, nonoxyl 9, may have been at risk for HIV infection. The only way was it opens up the female to being vulnerable for any disease, sexually transmitted diseases, if anything like that. If you're infected with HIV but have a negative ELISA or West Bolt test result, yes, you can. You can be a carrier and never ever get the disease. Why is it necessary to confirm the Western blot test with the results of the ELISA test? Because one test may show positive while the other may show negative, making it a HIV negative. Currently, this was interesting, currently millions of people are infected worldwide with both HIV and TB. But experts consider the two diseases twin epidemics. Why would AIDS and TB be commonly diagnosed in the same patient? Because their immune system is down and they get sick by the lightest drop of the hat. They're kind of like a chemo patient. You need to keep their immune system up and going. So in other words, you have to mask them if you come in contact with them. The benefits of the so-called holiday drug. What are some advantages of it? Well, it limits the toxic side effects of the anti-HIV drug. It permits the drug to regain effectiveness after a period of continuous use and reduce the tolerance effect that may be required by the increased dosage. And the therapeutic effect, sometimes used to reduce the drug side effects, the patient may enjoy a more normal life for a period of time, such as a weekend or holiday, or engage in a particular activity without being sick. Thank you and have a good day.